Hello, sir. I'm the your nurse for today. So for today, I will be assessing your genitalia. So it is necessary to do an assessment of the male genitalia for us to see any lesions, swelling, inflammation, and nodules. So for this assessment, I am asking for your 100% cooperation. So do you wish to have someone with you here while I'm doing the assessment?
No, I'm comfortable enough with this assessment.
Okay, so before we start, I will first perform hand hygiene and I will apply gloves for infection prevention. And I will close the door for your privacy. Okay, sir, so after securing your privacy, I am now going to start the assessment by asking you some questions if you have any history of the following. So, have you experienced any abdominal pain?
No.
Have you had any symptoms of sexually transmitted disease?
No.
Have you had any presence of swelling that could indicate the presence of hernia?
No.
How about malignancy of the prostate? How about malignancy of the kidney?
No.
Okay, so now I am going to assist you to a supine position with your head slightly elevated. And after that, I am going to cover your pelvic area with a sheet. Okay, so I am done with steps 1 to 5. Now I'm going to use this drawing for step 6. So now I am going to inspect the distribution, amount, and characteristics of the pubic hair. Okay, so I can see a triangular distribution, often spreading up to the abdomen, and I don't see any abnormal deviations like a scant amount or absence of hair. Okay, so I am done with step 6. Now, I'm going to use this for step 7 to 9, starting with the inspection of the penile shaft and the glans penis for inflammation, swelling, nodules, and lesions. Okay, so I can see that the penile skin is intact and it appears slightly wrinkled and varies in color as widely as other body skin. And I can see that from the glans penis, the foreskin is easily retractable and has a small amount of white smegma. And for any abnormal deviations, I will see a presence of inflammation, lesions, swelling, and nodules. And I will see that the foreskin is not retractable and has a large discolored and malodorous substance. Now I am going to inspect the urethral meatus for inflammation, swelling, and discharge. So I am going to compress the gland slightly to open the urethral meatus and to inspect for discharge. Okay, so I can see that it has a pink and slit-like appearance and is positioned at the top of the penis. And for any abnormal deviations, I will see a presence of inflammation and discharge. And if I were to see any discharge, I will instruct the patient to hold his penis or to strip the penis from the base of the urethra. Okay, so now I am going to palpate the penis for tenderness, thickening, and nodules using my thumb and my 2 fingers. Okay, so now I am going to start palpating. Okay, so I can see that there is no presence of tenderness and nodules, and for any abnormal deviations, I will see a presence of nodules and tenderness. So now I am going to inspect the scrotum for appearance, general size, and symmetry. And to facilitate the inspection of the scrotum, I am going to hold the penis out of the way. So I will now start to inspect. Okay, so I can see that the scrotal skin is darker in color than that of the rest of the body, and the scrotum appears symmetric in size, and for any abnormal deviations, I will see any discolorations and any tightening of the skin which could indicate edema or mass. Okay, so now I am going to palpate the scrotum to assess the status of underlying testes, epididymis, and spermatic cord. So I will both palpate the testes simultaneously for comparative purposes. So for this palpation, I'm going to use my thumb and my one finger. Okay, so I am done palpating. Sir, so now I am going to inspect your inguinal areas for bulges. Can you please stand, sir? Okay, so I don't see any presence of bulges or swelling, and for any abnormal deviations, I will see a presence of swelling and bulges. Okay, sir, so we're done with this assessment. I am now going to document the findings in your record. Thank you for your cooperation.